Hi, I'm Dr. Becca Bornat, a veterinarian for the National Shelter Medicine team with Best Friends Animal Society. And today we're going to be talking about canine infectious respiratory disease, also known as kennel cough. This term refers to an acute infection primarily affecting the upper respiratory tract, and it's one of the most common causes of respiratory illness in shelter dogs. Pathogens are bacteria, viruses, and other microorganisms that cause disease. CIRD is associated with several viral and bacterial pathogens. Clinically, healthy dogs can also carry respiratory pathogens. In a study of asymptomatic dogs, nearly 48% tested positive for at least one of the CIRD pathogens, with Mycoplasma, Bordetella, adenovirus, distemper virus, and parainfluenza virus being the most common ones. Co-infections are prevalent, and dogs with multiple infections may show more severe clinical signs. CIRD is transmitted through oronasal contact with aerosols of respiratory secretions that can travel up to 20 feet or even more by dog and dog direct contact and through contaminated fomites, which most of us are. Animals not presenting clinical signs may be shedding the virus or bacteria, and it's important to remind us that we must wear gloves and other personal protective equipment, also known as PPEs, when handling puppies and animals that we are not sure about their vaccination status. Additionally, remember to disinfect surfaces that they may have contact with. Incubation period is the time between the animal being exposed to a pathogen and getting sick. This will vary depending on what is the type of virus or bacteria, and it can be anywhere from 3 to 14 days. These pathogens are found everywhere, including in healthy animals. So why do some dogs get sick? It's really due to this classic interaction between host, environment, and pathogen. Host, we are thinking about age, their immune status, which is affected by vaccines, maternal antibodies, and other diseases. Stress, how stressed is that animal? We know shelters are extremely stressful for dogs, so we always need to try to minimize it as much as possible. Environmental, how crowded is their shelter? How good is the airflow? Is the food provided adequate for that dog? How good is the cleaning and disinfection process? And what type of disinfectant is being used? Pathogens, who is causing the disease, the severity of the disease, and also, are there other infections happening at the same time? But from all of this, the most important risk factor for disease in animal shelters is length of stay, because it leads to more potential exposures, more taxing is the stressful environment on their immune system. And so, when I have a shelter that is experiencing a lot of kennel cough, length of stay is the first thing I start asking about, in addition to all of these other factors. What about clinical signs? What do we see more often? It's cough, nasal discharge, ocular discharge, conjunctivitis, sneezing, mild pyrexia, inappetence, and lower respiratory signs sometimes may be present. And they are a red flag that maybe we are dealing with something more serious. But also, can see this occasional single pathogen infection or co-infection with the less serious pathogens. It is important to remember that canine distemper and canine influenza virus can mimic other causes of CIRD and show mild clinical signs in the early stages of the disease. So diagnosis cannot be done by clinical signs alone. And even with mild clinical signs, we need to be extremely careful and isolate those animals. We have all of these possible pathogens. So how do we diagnose what we are really dealing with? PCR testing is the #1 answer. And most of the common site samples are pharyngeal and nasal areas. Collection of these samples are ideally done within the first couple of days of clinical signs. After 5 to 7 days, it's less useful. Always contact your lab to make sure of specifics on sample collection and shipping. Interpretation of the results must consider that false positives can happen, especially due to wildlife vaccines or contamination at the shelter or at the lab. And false negatives can also occur due to testing too late in the disease, sample degradation caused by poor storage, shipping conditions, antibiotic administrations, and small amounts of pathogen collected. Additionally, you also can do necropsy, culture, and histopathology. So we have some coughing dogs in our shelter. Are we going to run PCR in all of them? Probably not. And when do we really need to test? When we are seeing increased number of cases, so disease surveillance to know what is the average number of cases you have by month, by year, it's really important. Is the increased severity, are the animals getting sicker faster? Are they not responding to the treatment you are providing to them? And all about also routine surveillance. Have a protocol for testing severe cases, but also periodically think about testing some of the not so sick ones. This is how you identify problems early, and this is how you know what's going on in your shelter. There are other CIRD management strategies that we are not mentioning here, but what I would like to keep in mind is that 1. Rapid recognition of the disease is everyone's job. All staff and volunteers should be trained to recognize clinical signs of infectious disease because early recognition is key to prevent outbreaks. And for prompt start of treatment, the delay of length of stay is the least amount possible. 2. Isolation is necessary. I know some of you are thinking, but we don't have an isolation room. But do you have a bathroom? Is there any area with lower foot traffic that you can use? And warehouse, a celiport. Even with a giant room, you can create respiratory isolation. Is that ideal? No, but you can save lives and reduce the spread by doing so. 3. Foster should be considered. With proper information, foster homes are the best option for those animals. It's less stressful and treatment is easier. And it's less work for shelter staff and decrease exposure at the shelter. Also, when needed, as already mentioned, confirm diagnosis, monitor closely the exposed animals, and avoid exposing more animals. By being mindful of people's and animals' pathway, how and where you move animals around the shelter, and of what animals we touch and if we really need to touch them. Most commonly, a 7 to 10 day course of doxycycline is initiated as the first line of antimicrobial option for dogs. And if clinical signs resolve, these dogs may be discharged from isolation and treatment discontinued after 7 days. The same way it is important to monitor animals for clinical signs, it is important to monitor them for improvement. If animals are not improving, diagnosis and treatment must be re-evaluated. We already mentioned some of the prevention strategies for CIRD, but let's remember that vaccination protocols should be shelter-oriented, and vaccination must happen at or before intake. Environmental management is key, so housing, how adequate it is for that animal, ventilation, how can we reduce stress, and how are we cleaning and disinfecting those housing areas. How rapidly are we identifying and isolating sick dogs, and how fast are we moving them through our shelter so we are reducing overcrowding and we are reducing chances of them getting sick. And remember when I said about avoiding exposing more animals by being mindful of people, animals' pathways, how and where we move animals around. And if we need to touch an animal and how we are doing that. So this picture, it is of me visiting a shelter partner. I took the picture to kissing this fluffy little thing to convince my animal care team of the shelter I was at the time to transfer him in. Did you see any gloves or other PPEs? No, right? He had parvo, distemper, and ringworm. Just to be clear, I don't do that anymore. But if the shelter I was working at the time didn't have strong biosecurity measures, we could have 3 outbreaks at the same time. So remember, we are all fomites. So be mindful how and when we touch them. I hope you enjoyed this mini video, and feel free to reach out to us if you have any additional questions, need help with CIRD or other diseases in your shelter. Just email sheltermedicine@bestfriends.org. Thank you.